Women's hormonal health is vital to their overall health. It's very important to understand this, but the problem is it's very confusing. The reason is that many practitioners are not well versed in the subject. This makes it very difficult for women to really understand what's important. They know intuitively that there's a problem, yet they don't get the answers that they truly need. We will discuss the difference in hormonal replacement, the safety, and what are the true benefits of hormone replacement. An example of this is that estrogen has 400 functions within the human body. These things include maintaining blood pressure, lowering cholesterol, decreasing belly fat, as well as skin health and bone health, which is vital to your body. The type of hormone replacement you use is also very important. The oral estrogen and progesterone are synthetic, the oral contraceptive. These types of hormones are foreign to the human body. So the body does not know how to respond to it properly, and more importantly, your body does not have the receptors that attach to these hormones correctly. The dangerous things that you've heard often about hormones all have to do with the oral synthetic hormones. Estrogen and progesterone that are synthetic cause problems. The other type of hormones are called bioidentical hormones. Bioidentical hormones mean that they are the exact same structure as your human body makes. So these hormones actually have the positive effects of the hormones that you have in your body and the important things that your hormones need. However, they do not carry the risks of synthetic oral hormones. So all of the research that has been done on bioidentical hormones has proven that they are safe and they produce the effects that you need with hormones. As we discussed, estrogen has 400 functions in the female body. It has functions as far as your memory and as well as your mood. There's been research that showed, that we're going to talk about, that estrogen actually decreases the risk of Alzheimer's disease. It's very important for your heart and your blood vessels. Estrogen actually decreases your risk of heart disease and it decreases your blood pressure. It's also very vital for your bones and many other things that we're going to discuss. It's important to understand that when women lose their estrogen, many things are affected, from your brain to your heart to your bones to your mobility. So estrogen is key as you get older. The symptoms of estrogen deficiency include things as low energy, depression, wrinkles, decreased libido, memory problems, weaker bones, increased risk of cholesterol. One of the things that we find many times with women is that when they're in their early 40s, they have normal cholesterol and they still do everything right, they eat right, they do all of the correct things, and then when they're postmenopausal, all of a sudden their cholesterol levels increase. We've seen this with many, many women, and the reason is that estrogen has a large part in the lipid management and your weight. Other things that happen with estrogen deficiency is developing of facial hair, and it also makes your skin thinner and creates wrinkles. One other thing that's very important with estrogen deficiency is that when you decrease your estrogen, you increase your belly fat. Because when you lower estrogen, you become more androgen, which are male hormone dominant. This causes a lot of belly fat that women have trouble getting rid of, and until you fix your estrogen, you can't get rid of it. Progesterone is very important for many things, but specifically for mood, depression, and anxiety. Women who are low in progesterone have a lot of difficulty with mood swings, also depression, and anxiety as well. The other thing that's very common in women, that women have a lot of insomnia as they get older, and the reason is because of the fact that progesterone deficiency causes this. So when you lower your progesterone, this will cause insomnia. And until you fix that problem, difficulty sleeping is common with women. The other thing that's very important with progesterone is very important to decrease the risk of breast cancer. Hormone replacement does a lot of things. We'll see when women are on hormones, they decrease their risk of Alzheimer's disease, they decrease their risk of depression and anxiety. They decrease their risk of heart disease, they lower cholesterol and blood pressure. As far as their bones, they decrease their risk of osteoporosis, decrease wrinkles, and their abdominal fat also decreases. So it's very important for us to understand what the research has shown with hormones. In Utah, there was a study of 1,889 women who were given hormone replacement. What they found was that 40% of these women had a decreased risk of developing Alzheimer's disease versus the women who were placebo or not receiving anything. Another thing that's very important is that estrogen decreases the neurotransmitter called serotonin. Now, you might have heard of serotonin in the past, but serotonin is very important. When you lose serotonin, it actually increases your risk of developing depression. Women who have low estrogen often develop low serotonin, which in turn increases their chance of developing depression. Next, I want to talk a lot about estrogen and your heart. What we have found is that women who are taking estrogen replacement have a few very positive effects. Now, they teach us in medical school that women who are postmenopausal have a higher risk of developing heart disease and heart attacks. However, they never explained why that was the case. Well, here's the reason. Women who lose their estrogen actually increase their risk of developing high blood pressure. So women who are on estrogen have lower blood pressure. Also, the other thing is that the amount of cholesterol you have in your body as well is affected by your estrogen levels. So when you have low estrogen, your cholesterol numbers all go up. Many studies have shown that women on hormone replacement, specifically estrogen and progesterone, have a much lower risk of heart disease. Skin and bones are very much related to estrogen replacement. Estrogen does a few things. It decreases wrinkles, decreases your risk of osteoporosis, decreases your chance of developing vaginal dryness. Also, interesting things, it decreases your risk of losing teeth and developing cataracts as well. Bioidentical progesterone is very important as a natural sleep aid. Women who have insomnia as they get older, it usually is because of the fact that they are having low progesterone levels. The other thing that progesterone does is it has a lot to do with your mood. When you have low progesterone levels as a woman, women have a high propensity to develop anxiety and depression. Now, the interesting thing about this is that when women have low progesterone, they often see their doctors, and their doctors will tell them, you're just depressed, here's an antidepressant. Now, the important thing to understand about this is that many of the antidepressants that you take that are given out normally actually lower your production of progesterone. So what happens then is that you're in this never-ending cycle where you're taking the medications, it's lowering the progesterone, and then all of a sudden you get more depressed, or the medicine doesn't work and you're put on another pill. It's a never-ending cycle because you never got to the cause and the root of